Have you ever stood up from a chair and noticed it felt harder than it used to? That small moment can actually tell you something important about your body. There's a simple test doctors and physical therapists use to measure exactly that, and you can try it yourself at home in under a minute. It's called the sit-to-stand chair test or the 30-second chair stand test. Here's how it works. You sit in a sturdy, standard height chair with a straight back and no armrests. You cross your arms over your chest, keep your feet flat on the floor, and then stand all the way up and sit back down over and over as many times as you can in 30 seconds without using your hands for help. That's the whole test. No equipment, no gym, just a chair, a timer, and your own body weight. Researchers developed it back in 1999 as an easy way to measure lower body strength in older adults, and it's since become one of the most widely used tools in healthcare. It's used to assess fall risk in seniors and to track strength in people dealing with conditions like osteoarthritis. So how many reps should you be able to do? It depends on your age and sex. In your early 60s, women typically manage somewhere between 12 and 17 reps, men between 14 and 19. In your late 60s, those numbers dip slightly, and the trend continues gradually downward through each decade. By your 80s, women often land around 9 to 14 reps, men around 10 to 15. By 90 and beyond, the range narrows to roughly 4 to 11 for women and 7 to 12 for men. This isn't only a test for seniors either. One study of healthy adults between 19 and 35 found they averaged around 33 reps in the same 30 seconds, which shows just how much strength and mobility shift over a lifetime. Every body is different, of course. Activity level, body size, and health history all play a role. So think of these numbers as guidelines, not strict rules. But generally, scoring well below the typical range for your age can signal reduced balance or a higher risk of falling. So why does this little test matter? Because it's really measuring two things that quietly support almost everything we do: leg strength and balance. Getting out of bed, walking safely, carrying groceries in from the car, all of it depends on strong, functional leg muscles. When that strength fades, mobility shrinks and the risk of falling goes up. And falls are the leading cause of injury and injury-related death in adults over 65. The story goes even further than fall risk, too. Research suggests that how well you perform on this test may reflect something bigger about long-term health. Better chair stand performance has been linked to a lower risk of conditions like type 2 diabetes, physical disability, depression, and even dementia. A 30-second test, offering a small window into much larger patterns of aging. Here's the encouraging part. If your number comes back lower than you'd like, that's absolutely something you can improve. Consistent strength training can boost chair stand performance in as little as 12 weeks. A few strategies stand out. Practicing the sit-to-stand movement itself slowly and deliberately at home builds strength over time. Strengthening your quads, glutes, and hamstrings through bodyweight squats, lunges, or resistance bands helps target the exact muscles this test relies on. Core work matters too, since a stronger core improves balance. Simple moves like bird dogs, standing chops, or knee planks can help, and balance-focused practices like yoga or Tai Chi are worth adding. Tai Chi especially has strong research behind it for reducing fall risk in older adults. Above all, consistency makes the difference. Lower body strength naturally declines with age, especially after 50. But regular movement, ideally strength training 2 to 3 times a week, helps preserve muscle and protect your mobility for years to come. If walking becomes more difficult, if you're falling more often, or your balance just doesn't feel like it used to, that's worth a conversation with your doctor. They can help pinpoint the cause and guide you toward the right exercises or support to keep you steady and strong. So next time you sit down in a chair, give it a try. Set a timer for 30 seconds, cross your arms, and see how many times you can stand up and sit back down. It might just be one of the simplest, most revealing health checks you can do at home. Subscribe and turn on notifications so you don't miss the next update, especially if any of these outbreaks reach your state. Thanks for watching.